Okay, so I'm just going to run through what we would do if we're going to be performing an ABG. So one thing we need to do is we need to just treat it exactly how we do all the other things that we've learned. So we need to make sure that we decontaminate our hands. We need to make sure that we clean our tray with our wipes before we go and collect our equipment, so inside and outside of the tray. And then we need to collect the equipment that we need, so that would be a ABG needle, some gauze, a wipe, some correction wipe, some tape, some gloves and a sharps bin. The equipment that we're going to be using is this particular brand of ABG needle, which on the side here is a self, like we talked about in the venous VBG video, it's a self-filling needle, so the plunger is actually hollow, allowing air to escape out through the plunger, and but when it gets wet, the end of the plunger, that will stop anything going out the back of it. So we need to then make sure we create enough space within the needle to be able to fill up. Once we've done that, we can then, the syringe is prepared, and then we can go towards our patient. We need to obviously introduce ourselves, explain what we're going to be doing, get consent. If we are going to be sending this sample to the lab, we do need to make sure we have ordered the blood sample on eCare and check the patient's ID normally. If we're actually doing a quick test on the ward, we still need to use a patient label in order to be able to verify the person's identification and adhere that label to the actual syringe. I'm then going to get the patient in a good position, perform an Allen's test on this person just to make sure that their collateral supply is satisfactory. And then I'm going to make sure that everything's okay, palpate my artery, make sure I know exactly where I'm going to be going, and then give it a good clean with 2% chlorhexidine. Okay, so while that's drying, I'm just going to put my gloves on. And then I'm going to then make sure that I don't forget to open up my gauze, because there's nothing worse than getting to your patient and realising that you haven't opened your gauze up, and then you've got to ask someone to come and do that for you. Okay, I'm going to hold my blood gas syringe like a pen with finger and thumb either side and my middle finger underneath. I'm going to make sure that my bevel is up, and I'm going to put my finger on the artery, and I'm going to make sure I hold my needle at a 45-degree angle or less and stretch the skin so it doesn't hurt, and I'm going to then push forward slowly into the artery. It's important to go really slowly, because if you're going too fast, you'll go through and out the other side of the artery by the time you see the skin tract, by the time you see the flashback. So push forward nice and slowly, and there I can see that I've got some flashback. My ABG syringe is filling up, and that is now full. Okay, right, so now I've got that, I can then get my bit of gauze, place that over the puncture site, and then push down firmly on the puncture site with a small surface area with one finger, and then and hold that pressure on there. I'm the only person who can do that. I can hand it over to someone who's trained, so a doctor or a nurse, but if you can't hand it over to anyone else. I'm then going to activate my safety device by holding it in my syringe very gently and sliding the thumb plate up until I hear a click. I'm then going to turn it the other way up, and I'm going to twist the syringe inside the cover so I can pull it out and drop the sharp into the sharps bin. And then push my syringe onto the cap, and then fill the cap up with a little bit of blood so it forms a seal. Now that is my syringe there now. I'm going to hold the pressure on this patient's artery until it's stopped bleeding, and when I feel it has stopped bleeding, I'm then going to remove the pressure very gently, look carefully for signs of bleeding or hematoma formation, have a little feel to make sure I can't feel any lumps or bumps or the hematoma, and if I can't, I'm then going to stick down my gauze with my tape and leave the patient like that. You can't ask a patient to hold this for you. It has to be something that a trained member of staff does. Once you've done that, I'm going to label my sample at the bedside. I'm then going to take it to wherever I'm going to be processing it, on the ward or to the lab, and then I'm going to wait for my results. And once I have the results, I'm going to make sure that I do something with the results. I can't just clip them to the patient's bedside. I need to hand someone who's going to analyse them. And that's it. Thank you very much.